Hi, my name is Dr. Adrina Holian. I'm a recent graduate of the University of Southern California School of Dentistry. I'm very happy to film this video for Educate Simplify. I hope that you all like and subscribe to this channel so that you can be up to date with all the current new videos that we have for you here. So today I'm going to be talking about oral health care and proper care of dentures and partial dentures. It is very important that patients take care of their oral health. If a patient is unable to do this due to a disability, it's very important that the nursing staff do this for them. A patient should be brushing their teeth at least 2 times a day, once in the morning and once at nighttime. In addition, they should be flossing at least once a day before brushing at nighttime. When a patient brushes their teeth, it is important that the toothbrush be angled 45 degrees towards the gum line on the lower teeth and 45 degrees up towards the gum line on the upper teeth. When you're brushing the patient's teeth, especially older patients, you want to proceed in a short vibrating stroke until you've brushed all of the teeth. This is also done on the top of the teeth, on the biting surface, and also near the area of the gum, of the tongue. In the anterior area, you want to brush out, and also on the top, you want to be brushing out. Brushing should take a total of 2 minutes, and ensure that the patient rinses the toothpaste out after they brush their teeth. So when you are flossing someone else's teeth, you want to make sure that you handle the floss properly. You need to wrap the floss around your middle fingers, and you form kind of an L shape or a goalie shape here with your thumb and your index finger. This allows you to stabilize the floss. You want to make sure that there is at least 1 inch of floss showing, and then you can guide and manipulate the floss in any direction between the corresponding teeth. So for example, here you slide the floss in between the teeth, and you will then hug the tooth in a C-shaped manner, hugging the tooth, and you go up and down 5 times per tooth. Once you've done one side, you'll guide the floss and hug the tooth next to it 5 times, as so. The frequent consumption of more than 3 times a day of fermentable carbohydrates in between set meals of breakfast, lunch, and dinner can lead to the development of tartar and plaque buildup and eventually lead to the formation of cavities. Fermentable carbohydrates include sticky foods such as caramel, gummy bears, or even dried fruits such as dates or figs, and even raisins. It's okay if a patient eats these things, but it's very important that they understand the importance of brushing their teeth properly right after they enjoy these foods. A complete denture is a denture that replaces all of the patient's missing teeth, either on the upper, lower jaw, or both. A partial denture, on the other hand, replaces missing teeth in a patient who still has some of their retained teeth. Most partial dentures are held in place with clasps, which are the metal parts that fit around some of the teeth. It is not necessary for the clasps to be very tight, as this may make removal of the partial denture difficult and may harm the teeth. Be very careful when removing or inserting the partial denture so that you do not bend or distort the clasps. If this occurs, you must have the patient see a dentist to adjust the clasps. Do not try to do this yourself. The large bar that connects the 2 sides must not be bent or distorted. This sometimes occurs by dropping the partial denture. In this situation, a new partial denture must be made for the patient, as it is not possible to return the bar to its original form. Biting into food may be difficult at first with a set of complete dentures. So you want to make sure that your patient understands that they no longer will be able to bite into an apple or corn on the cob. It is necessary to cut the food into smaller pieces so that the patient can properly enjoy these foods without dislodging the dentures. Patients who wear either partial or complete dentures should avoid sticky foods such as gummy bears or chewing gum. Dentures need to be cleaned every morning and every evening. It is best to clean them over a sink full of room temperature to cool water. Using hot or boiling water can actually distort the dentures, so you want to avoid anything too hot. Make sure that the dentures are always handled carefully, as they are made of acrylic and can crack or break fairly easily if they are dropped. So always make sure they're handled over a sink full of water or over a wet towel. Remove debris on the denture with a denture brush, not a regular standard toothbrush, as this can cause damage to the denture. In addition, a regular toothpaste should not be used, rather a denture paste, which can be purchased from a general store, as these do not contain the abrasives found in regular toothpaste. Dentures need to be rinsed after each meal. No matter how well a denture may fit, food can still get lodged underneath them, and if not properly cleaned in the morning and at nighttime, it can start to cause a foul odor. Tartar tends to collect on dentures just as it does on natural teeth. This can often be removed by soaking the denture in white vinegar for an hour or more. Another problem is stain, which comes from smoking or drinking too much coffee or red wine. Many commercial preparations are available, but you can make your own cleaning solution by using 1 teaspoon of kitchen bleach in a glass of water. Soak the denture twice a week for 20 minutes in the solution, and the denture will be relatively free from stain, tartar, and bacteria. Do not soak metal partial dentures in this cleaning solution, as it can actually cause damage to the metal on the partial denture. Dentures should always be stored in one of two places. This can be in a denture carrying case at nighttime if you're not wearing them, or in your mouth. Dentures should be soaked overnight in a simple water solution in a glass of water. Patients who wear either complete or partial dentures may develop sore spots. These can be adjusted by their general dentist by going and visiting them. This is pretty common to have sore spots develop, especially right after a new set of a partial or a complete denture is made. You will know if your patient has a sore spot by them either letting you know, their refusal to eat, or their refusal to wear dentures. The sore spot will look like a bullseye and will be red in color. This area will be very sore and tender to touch, but will most likely go away after an adjustment made by the patient's dentist. Older patients are at increased risk of developing oral cancer, and their risk increases if they have a family history of oral cancer, if they smoke or have a history of smoking, or if they currently drink alcohol or have a history of alcohol consumption. Therefore, it is important for a patient to have a dental checkup at least every 6 months or once a year by simply visiting their general dentist. Oral cancer can easily go unnoticed and grow very quickly in a very short period of time. Early detection and treatment by the patient's dentist can save a life. So nurses, you do play a very big role in early detection. By taking a quick look in your patient's mouth, you can really save a life. I hope you enjoyed this video. Please feel free to like, comment, and subscribe to Educate Simplify, and we look forward to hearing from you, your feedback, and also this will allow you to stay up to date with current videos and new CE courses that we have available for all of you. I hope that you have a wonderful day, and thank you again for watching.